The latest on the pandemic, a staggering 21,099 new infections logged in the last 24 hours, as well as 99 deaths. And this translates to a test positivity rate of about 30.6%. We'll keep watching that important story as always. In fact, let's have a discussion related to it. Results from a preliminary analysis of the severity of the COVID-19 Omicron variant by researchers at the NICD has revealed that people infected with this mutation are less likely to end up in hospital. The assessments were done in the 3 weeks since the variant was first discovered. Now, compared to the second and third wave, there's a smaller prevalence of severe disease in this current wave, which is fueled, as you know, by the Omicron variant. Prior immunity from vaccinations and improved national immunity were, some of the reasons for this, we're told. So does this mean that Omicron is less virulent? And will the data hold up, at the peak of the fourth wave? Well, to try to answer these questions, let's bring in Head of Public Health at the National Institute for Communicable Diseases. That's Dr. Michelle Groome, who joins us via our video link. And Doc, it's great to have you on the program. Thanks very much indeed for always making time. For the benefit of our viewers, we've tried to condense some of the data itself. And I want to just bring up a table where we compare, various things from the first wave all the way to the fourth wave. The fourth line there on that table is showing the proportion of cases admitted. And I see at the peak of it, 16.2% of those who catch the virus landed up in hospital. In the fourth wave, we're seeing that figure only at 5.7%. I imagine that's kind of the message that was delivered yesterday. It appears fewer people who are getting infected with Omicron are landing up in hospital.
So that's definitely the message that we're seeing from this early part of the fourth wave. And I think it's what we would have expected. So in the third wave, we were going into the third wave very much. We vaccinated the healthcare workers, but we'd only just started with the vaccination of the other population. I think we had 2 previous waves, and there was some kind of underlying natural immunity. But going into the third wave, we were really, not a very protected population. And so we would expect that, we had a big third wave, quite long, that a lot of people in South Africa would have been infected, either asymptomatically or symptomatically. And obviously we haven't reached our vaccine targets yet, but we vaccinated close to 40% of our adult population. So I think we're in a much better position. And what we'd expect from prior infection and vaccination would be to decrease the severe disease outcomes. And that seems to be what we're seeing in this initial period of the fourth wave.
So that suggests to me, at least, that, it's not necessarily about Omicron being less virulent as a mutation. It's just coming at a context, or in a context rather, where there's just a whole lot more protecting us against something like severe disease.
Yeah, definitely. So I think it's a big question, and it's not, I guess, definitively answered. But I think is the variant less virulent or less likely to cause severe disease, or is it, some, factor in our population? And I think a lot of the international, countries are interested in our scenario, but it's not necessarily kind of translatable to a different setting.
Yeah.
And so our feeling is that it's most likely more due to the underlying immunity, either from vaccination or natural immunity. But obviously there have been some studies in the lab showing that Omicron does have a slightly different way of getting into the cells, and that there may be slightly more Omicron presence kind of in the upper airways than in the lungs.
Right. But
we need to kind of wait for more results or more studies like that.
Yeah. Well, there's another graph. Bear with us as we bring it up. Guys, can we bring up that percentage of hospitalizations in the first 4 weeks of infections is essentially comparing, according to age groups, how many people landed up in hospital. And we're seeing, interestingly enough, in the fourth wave, it's those between the ages of 20 and 29 who seem to have a high number of hospitalizations, as well as those between the ages of 30 and 39. What's that about?
Yeah, so I think it is also, I guess, would expect that, So in any program, we've been vaccinated and started our vaccination program in the older age group. So those, our over 60s, I think, have over 60% vaccinated. And so you're sitting with them having a lot of probably prior infection because they were quite susceptible in the initial waves. And our younger population really, has a much lower vaccine coverage. So you would expect that shift into the younger age groups. once again, we don't know whether there's something specific with Omicron that maybe, tends to, that there may be some biological mechanism for the younger age groups. But definitely from an epidemiological point of view, we would expect to see the shift.
Yeah. I've heard of a term, I think it's called the decoupling of infections, hospitalizations, and severe disease. It sounds quite intense, and I feel very smart when I say that, but help us break down what that means, but more importantly, how it should inform how we respond to this pandemic in a context where we're also taking stock of the economic fallout that comes from something like a hard lockdown.
Yeah, so I think what we've really seen in previous waves, and if you look at any of the wave graphs, you even start seeing the hospitalizations even slightly before the cases start increasing. But you see this rapid rise in cases or, increasing cases, and followed very closely, like almost along the same line or trajectory or slope of that curve. You're seeing the hospitalizations and deaths go up. And so the decoupling is kind of what we're seeing, and we've shown that for Gauteng and starting to see it nationally now, is that the cases have gone up really rapidly, but we haven't seen the same degree of increase in hospitalizations that you'd expect with those case numbers. So, I mean, when we were previously in the third wave sitting at a 7-day moving average of 20,000, our hospitals were really being over capacity, or at least were full. We're not seeing that this time. And in terms of our deaths, even our excess deaths, you've almost got the deaths. There's a slight increase, but it's relatively flat compared to what we saw with the previous waves. So that's what that decoupling means. It means we're not seeing the same rate of increase in hospitalizations and deaths as we saw with cases.
And again, we had always appreciated a lockdown to only be necessary in a context where, there is pressure on the health system.
Yeah.
Yes, we're seeing a lot of infections, but no, we're not necessarily seeing that translate in a lot of hospitalizations.
Yeah.
Does a lockdown make sense?
Yeah. No, so I think I'm really happy that we have been able to kind of not end up going to a higher level of restrictions. And I think it was something I think many were advocating, that we really base our decisions more on hospitalizations and deaths. And I think going forward, we're just re-looking at the pandemic and the way, almost 2 years in, that I think hospitalizations and deaths are going to be the important indicators. And the number of cases is really, we're reporting that every day, but I think it's going to become less useful over time. Because for one thing, we already, there's differential, reasons for testing. So those positives are a mixed match of people traveling or, being sick, not being sick. So I think the cases will become less useful for tracking. And definitely it's the hospitalizations and deaths. And I really think if we can kind of get through, this wave with, the current restrictions in place, I think it'll really, help us in terms of really, just coming to terms with this disease being around. It will cause infections, but we need to limit, those severe outcomes.
We certainly get a sense that living with COVID-19 might look like something what we're experiencing now, which is, infections in the thousands, but that not leading to deaths and hospitalizations, which has always been the message behind why it's necessary to get a vaccine. But, on a related note, you spoke about tracking just, in your response now. I was taken aback by that circular, it appears, or some kind of note written by the Ministerial Advisory Committee's co-chair, I think, to the President, essentially calling for an end to contact tracing and isolation. Now, that to me almost sounds like we're kind of opening the floodgates for the virus to do whatever it needs to do. Is that the case? Is that an accurate reading of the situation? For one, are we putting so much of our trust on vaccinations and natural immunity that we don't need to contact trace anymore?
So it's not really about trusting vaccines or, opening the floodgates to infection. I think really the reality is that, our daily case numbers, we've got just over 3 million. And we know that's an underestimate. It's probably 10 times more than that. We've probably had 30 million who are actually exposed. But we're not testing everyone who's symptomatic. And there's a lot of asymptomatic infection. So the reality is that you may be quarantining those people that are testing positive. But there's, maybe 10 others that haven't tested and are asymptomatic who are, spreading the virus. And I think we know a lot more now than we did at the beginning. I think at the beginning it really seemed like it was more spread by droplets, which really, then close contact, droplets drop within, a meter or so. But we know now that there's, a lot of it is more aerosolized, so that means it's tiny little particles in the air which can drift much further than a meter. And so these types of things really just, looking at the science, I think there is an indication that those measures just might not be as useful as we thought right in the beginning. And so it's actually, it may not, translate into increased transmission. I think what we've seen, especially with Omicron, it's highly transmissible. And in the face of a very high, a highly transmissible variant where even before, if I become positive, and I test on Monday, and I've actually, been shedding virus the last 5 days, I think you've already spread a lot of that. So I think, there definitely is some scientific basis for it. But I think, in terms of the absolute policies, I think at the moment the MAC obviously provides a recommendation, and this is under consideration, at a higher level.
So to be clear, if this recommendation is taken on, despite how loosely I've actually tried to capture it, would that also suggest that even those who know that they're positive should just go about their days because, well, I mean, as you pointed out, they've been doing that for the past couple of days anyway, and the only difference now is that they know that they have the virus?
Yeah, so there's a difference between the quarantining and the isolation.
Right.
So I think so there's separate advisories for that. So the one is in terms of people who are close contacts. So if I'm in contact with someone now that tests positive. So I think that's to do with some of the lessening of the kind of restrictions around that. But for people who actually test positive, the isolation guidelines will still be in place, and they may be slightly reduced, or at the moment these are 10 days. So I think for those that we know are positive, they would still need to isolate.
Okay, that sounds so slightly more assuring.
So it's the close contacts versus people who are positive.
All right, that's a comfortable intermediary, at least for now. And then just lastly for me, I mean, I've heard in the past of people trying to understand COVID-19, suggesting to us that a virus will do one of two things to survive. It'll either try to mutate so that it spreads much quicker, but that usually comes at a cost of not being as virulent, or it'll be very deadly, but will be, it will struggle to spread. What is Omicron telling us about where on the spectrum it might lie, and more importantly, how COVID appears to be working?
Yeah. So I think if you look like something like Ebola, has a very high mortality rate. So it tends to not spread as quickly because, if you're infected, you'll die and you're not able to pass it on. So definitely viruses, like Omicron, it's definitely trying to become more transmissible so that it continues spreading. I think the thing is, there's a bit of a misunderstanding in terms of the severity. So it might not necessarily go towards milder disease because the outcomes of COVID are later. So say you only start maybe getting your severe disease, usually at about a week. You may be hospitalized, may only die 2 to 3 weeks later. And by that time, you've already spread it. So I think in terms of COVID, it doesn't necessarily link the transmission with severity, because by the time it transmits early on and your outcomes are only later. And so it doesn't really care, if you die or not later, because in the beginning you're alive and you can spread it. So, it will be interesting to see. But I think definitely in terms of COVID, the transmissibility seems to give it an edge. And obviously some of the immune escape, because that if it can evade our immune system, obviously it can infect you more. So I think it's a bit early to kind of link the transmissibility with severity in terms of how it's mutating.
Right. Fascinating nonetheless. Thank you so much as always for making time to break these down for us. At least for us mere mortals, really do appreciate your time here on Newzroom Afrika. Dr. Michelle Groome is the head of public health with the National Institute for Communicable Diseases. Once again, thanks very much indeed.